Imagine a groundbreaking technology that could potentially revolutionize the way we treat diseases like cancer, but is being held back by a crisis of trust. This is the stark reality facing the mRNA platform, a promising technology that's been at the center of a heated debate in recent weeks. But here's where it gets controversial. According to Jay Bhattacharya, director of the National Institutes of Health, NIH, the federal government has canceled millions of dollars worth of mRNA research contracts due to a lack of public trust in the technology. Bhattacharya made this startling revelation during an episode of Steve Bannon's podcast, War Room, and again in a recent op-ed published in the Washington Post. In the article, he acknowledged the potential of mRNA technology to lead to breakthroughs in disease treatment, but emphasized that its failure to earn public trust is a major obstacle to its success as a vaccine platform. As he put it, no matter how elegant the science, a platform that lacks credibility among the people it seeks to protect cannot fulfill its public health mission. This begs the question, can a technology that has shown such promise in the lab really be doomed by a lack of public trust? And this is the part most people miss. The NIH's decision to cancel mRNA research contracts is not just a matter of public perception, but also reflects a deeper concern about the technology's safety and efficacy. Bhattacharya expressed concern about the ability of mRNA vaccines to direct human cells to produce spike proteins, which could trigger an immune response. He also raised questions about the long-term effects of mRNA products on the body, and whether they could lead to the creation of other proteins. But not everyone agrees that these concerns are unique to mRNA technology. Scott Hensley, a microbiology professor at the University of Pennsylvania, pointed out that similar issues arise with vaccines that use live but weakened viruses, such as the measles, mumps, and rubella vaccine. He argued that these concerns are addressed through rigorous human clinical trials, which have shown both mRNA and live attenuated vaccine platforms to be safe and effective. So, what's behind the public's distrust of mRNA technology? Bhattacharya blames the Biden administration's COVID-19 vaccine mandates during the pandemic, which he says undermine the public's trust in public health officials. As he wrote in his op-ed, science isn't propaganda, it's humility. And when public health officials stopped communicating with humility, we lost much of the public, an absolute necessity for any vaccine platform. This raises a critical question. How can public health officials rebuild trust with the public? And what role should humility play in their communication strategy? The controversy surrounding mRNA technology is far from over, and it will be interesting to see how the debate unfolds in the coming weeks and months. But one thing is clear. The fate of this promising technology hangs in the balance, and it's up to us to have an informed and nuanced discussion about its potential benefits and risks. So, we want to hear from you. Do you think the NIH's decision to cancel mRNA research contracts is a step in the right direction, or a misguided move that will hinder the development of life-saving treatments? Share your thoughts in the comments below.